I'm Kaylee. I'm one of the PGY2s here at CMC. Welcome to our CMC tour. This is the main entrance to our hospital, so why don't you come with us and we'll show you around. So this is the main lobby to the hospital. Here's our Panera bread. We'll come down here often, get some coffee, get some breakfast before we head to either clinic, the OR, or rounds. This is 11 Tower. This is one of the main surgical floors that we have in the hospital. It's the home for mainly our hepatopancreabiliary service, as well as our GI oncology service, as well as some of our general surgery patients that are floor patients. You'll spend a lot of time on 11 Tower for patient care. So here's the main desk to 11 Tower. In here is the nursing station where a lot of our nursing colleagues work, and then over here is where a lot of our case management sits. So they're extremely helpful for us with placement, especially for a little bit more complicated patients who may need a little bit of extra stuff when they leave the hospital, and we rely on them really heavily. Hello. All right, this is our physician workroom. This is Misty. She's one of our HPB APPs. We work really closely with her, especially intern year. And then this is Buck. He is one of our PGY5s who's going into colorectal surgery. Misty, what's your favorite part of working with the residents?
I think the upper levels, watching them advance from their intern year onto like chief year especially, and be more independent and grow and make more decisions. And then for intern year, being able to work with the interns and kind of train them on what we do and how we do it and kind of the basics of surgery and medicine and how it's different at this institution than other places, and each surgery line is different.
Awesome. Thanks, guys. It was good to see you, Misty. Bye, Buck. If you follow me this way, this is the way to the cafeteria. It is the only cafeteria that we have in the hospital, but we do have a lot of places that you can get food, either that your badge works at or that you can kind of pick up some food for free here and there. So this is the residence lounge here. This is one of the designated spaces for residents only within the hospital. I'm going to take you inside. Here's a bunch of our other co-residents. This is Leslie. He's a PGY4. This is Mike Mala. He's a PGY5. And then these are two of my co-residents, Jess and Mike, who are both PGY2s. Did you want to talk a little bit about why you picked CMC as a residency program?
Yeah, so for me, it was just the right fit. Stands out that going the program was strong clinically, and also gave some opportunities for extracurricular activities, like people doing global surgery, research, and all that. And also, in addition to that, just the residency atmosphere, culture, the family here. Ultimately, the city is beautiful too, so. All
right, so these are where our call rooms are located. We actually have a number of call rooms around the hospital for the general surgery and the trauma services for people who are here at night. Here we have 3 call rooms. At any given time, there are 3 people in-house for our night call system. So let me show you some of the call rooms that we have. So this is our intern call room. This is Ansley Ricker. Hi. Ansley, I know you just finished night float. Would you mind talking a little bit about your experience and how all of that was for you?
Yeah, so night float, it's just me in-house with an upper level resident. You really just you put out all the fires that go on for all the surgery teams like all night long. So you manage calls, you see ED consults. So it's really just living moment to moment. So it was a lot of growth, and I gained a lot of independence. I got really efficient, which was good. But yeah, it was different, but it was a lot of growth happening. So
yeah, I think one of the great things about intern night call too is you're with the same team for the 2 months that you do it, and so you get really close with your mid-level as an intern. It is a good opportunity to meet mid-levels, form relationship with mid-levels, and kind of have somebody on your side when you have questions or anything like that. So this is the entrance to our surgeon's lounge. This is an area that we use really extensively. Everybody gets numbers here in the morning, meets here before rounds. They have lunch served daily here, and then just a lot of our social time is here as well. It's kind of our main home base of the surgery residency. Speaking of home base, this is probably the largest group of gathering residents that we'll find today.
I'm Mike Getz. I'm one of the chief residents here.
This is Mike Arnold. He's also one of our PGY5s. He just matched into pediatric surgery. Do you want to talk a little bit about your research experience here?
I was in the class lab, which is our minimally invasive research lab, and we have a few options of labs to go into here, and I think one of the highlights of them are they're very productive, which is certainly important for helping match into a competitive fellowship, and learning how to do research. And another thing is your position is paid for, so you don't have to find grant funding to pay for your extra year. The department covers that. We have statisticians at the hospital, research coordinators, and so a lot of the extra work of like consenting patients and making sure things get through the IRB are taken care of, and you write papers.
And then this is Josh. He's one of my co-classmates. He's a PGY2. Josh is actually from Oklahoma, so we do have a pretty far-reaching realm of where we have people come from. Josh, do you want to talk a little bit about why you chose CMC?
like Kaylee said, I'm from Oklahoma. I came out here for an array rotation. I was really impressed by the culture here at Caroline's Medical Center. I feel like we have a great operative experience, getting to the OR very early, and then there's just amazing camaraderie among the residents. So it's a great place to be with family.
All right, so this is another one of our workspaces. This is Jared. He's actually one of the urology forwards now, right, Jared? And so we work really closely with him. Welcome to our main operating area. This is where the vast majority of the operating rooms in the hospital are located. We have 46 ORs in this area alone, 3 to 4 of which are robot ORs. You actually are able to get on one of the consoles to practice during your free time if there's no cases going on, and that's usually at night, so the night float residents have access to that as well. In addition to this area, we do have 11 additional ORs in our one-day surgery center. That's where a lot of our breast surgery happens, some of our head and neck surgery happens. Plastic surgery rotations will happen down there as well. We do share that with a couple of other service lines as well, but most days we do have residents operating in one-day surgery. This is Patrick Salibi. He's one of our HPV fellows. We actually, I know there's always a lot of question as far as what the fellows' role is in a residency program. Our fellows do a really great job of sharing. We always have a resident, a 4th year that's on the HPV service, and then I know that the intern on the HPV service has really spoken highly of Patrick as the senior fellow at this time as far as getting him into the OR and doing a number of cases when he was on as well.
Lots of fun. We love working with the residents. They're great to work with. They get to learn a lot about critically ill patients and how to manage them at night, and then get involved in the OR doing kind of an anastomosis every time we take so much over quadrant out. So.
All right, so welcome to one of our ORs. Obviously there's not a case going on in here right now, but this is generally what they mostly look like. This is a pretty standard looking OR for what we have here at Atrium, unless it is a robot OR, in which case there will obviously be some robot consoles. This is Mike Arnold. I think you guys met him upstairs in the surgeon's lounge, but he's one of our PGY5s. He is currently the chief resident in our general surgery red service. If you wanted to tell us a little bit about that, I think it's one of our strongest parts of our residency here from both a lower level and an upper level perspective.
Yeah, so the red service has historically been our chief run service. We all do a couple months on the rotation as chiefs, and then we have interns and mid-level residents on the service too. It really is nice. It's a chief run service. I rounded this morning with the junior residents and the nurse practitioners on the team, and saw all the patients, basically came up with a plan for the day. We do get supervision. Our attending generally will come around behind us and sort of say hi to everybody and make sure everything's okay. But the idea of the service is that we get to do what we want as long as it's within reason. So if you want to do a case laparoscopically or on the robot, or if you want to do it open, as long as that's kind of within the standard of care and appropriate, we can make those decisions. Or if it's non-operative management, or if you want to be more aggressive with things too, again, if that's within the realm of what's appropriate, we get to really decide all that stuff, which makes it a rewarding service.
The nice thing about it being a chief service too is the chief residents actually do, I would say they're involved in operating in at least 85% of the cases that are happening at any during any month, and they will work with the 3 or the 2 and the 1 that are on the service. And so I know as an intern, I was doing XLAPs, a chief and I, the attending was, there with us, but I was actively involved in a lot of those cases. I did a whole bunch of appendectomies as an intern. I did my first gallbladder as an intern. So it's definitely, the chiefs use it as a great teaching opportunity. The lower level residents and the mid levels, it's also a great learning opportunity for us, and everybody gets a ton of OR time when they're on this service. All right, welcome to one of our ORs that people are actually operating in. This is Dr. Rossi, one of our PGY3s, and Dr. Augenstein, one of our attendings. Right now they are doing a ventral hernia repair. As you can see, our mid-level 3 is doing the vast majority of the operating, which is great, so we really do want to highlight that we get into the operating room and we do a lot of stuff. I'm really excited that Dr. Augenstein and Iselina are here because they are really important parts of my personal residency experience. Dr. Augenstein has been immensely helpful in starting up our women in surgery group that we started this year, which we wanted to highlight a little bit. The first Friday of every month we reserve, no females are actually on call during that time, and a huge thanks to our scheduling chief for both the trauma and general surgery schedules and making sure that all happens. We couldn't do it without the support of our male colleagues as well. And so we've had a few months now where we've met. Dr. Augenstein actually was gracious enough to host the first meeting at her home, and where we discussed a bunch of articles, had some dinner, got to spend some time with our female colleagues. Welcome to Trauma Bay 1. This is where all of our Trauma Code 1s, Trauma Code 2s come into the emergency department. Here at CMC, within our residency, we get a really wonderful trauma experience. We do a little bit of trauma almost every single year of residency. So we spend a lot of time in this bay. We work really closely with our emergency department residents and coworkers. We do have a really great relationship with them. This is the library that is actually located on the main campus at CMC. It's open 24/7 for resident use. You have badge access, which can get you into the library anytime you want. The learning does not end in residency. We do have our yearly in-service exam. The AppSite happens in January every year. One of the perks of our program, they do supply us with a free SCORE subscription each year. Additionally, SCORE is not for everybody, so we do have that fund, our GME funding. We get $1,900 a year towards educational costs. This includes textbooks or any other question banks or anything that you may work better with. We've made our way now up to the actual Department of Surgery area. I wanted to introduce everybody to Shelly. Shelly is our program coordinator.
So the favorite part of my job is being like the matriarch of this entire group, because when you come here, you'll feel it. It's like a big family. It's almost like when everybody's in the same room, you feel like you're at this family reunion. And it's just the best part of it is being able to sit back and take all that in and watch everybody grow. Seeing the growth is unbelievable.
There's so many things to consider. I think really one of the most important things to do is the support that you have, both from your co-residents as well as the staff that's around. I wouldn't even refer to Shelly as staff because she's that important to us, but I think that finding a program coordinator that supports you and helps you along the way is really of utmost importance.
Not just one person getting through a program. If you're in a really good program, then everybody in that program is interested in you getting through that program in the best way that you possibly can. And so depending on every resource you have is very, very important. So keep that in mind when you're shopping around for programs. You want to make sure that you have the best support network you can possibly have.
Thanks for joining us on our tour of CMC today. This kind of concludes the end of our journey with you guys. We hope to see you guys all here in the fall.